Hey everybody, thanks for jumping back onto our last session of the day. So we are at the home stretch. Uh, Wanted to again thank everybody for spending the time with us, and wanted to give another kind of call out to our sponsors. So again, platinum sponsors, we have Fortinet, UpDocs, and Cisco. For Premier, we have Cover My Meds, Nordic, and VirtuStream, and for elite sponsor Trinisys. So as earlier, definitely highly recommend if there's more information you want to learn about any of those, definitely check out their websites, and we'll have more updates on our website as well for the CSOHIMSS to also give you more of that direction as to how to investigate them more. So again, this is our last session, and wanted to end with ransomware. So we have with us Troy Ament. He's the Fortinet Field CISO for healthcare and has over 20 years of experience with Fortinet, transforming IT and security programs. Out of those 20 years, 14 of those years in the healthcare sector, or has been in the healthcare sector, as an executive overseeing clinical technology implementations and serving as the CISO officer at two of the largest integrated health delivery systems in the United States. So as we all know, I mean, especially as of late, there's a lot of stuff in the news with respect to healthcare and ransomware threats. So the timing, frankly, could not be any better. So with that, Troy, I'm going to turn it over to you.
All right, thank you, Mark. And yeah, so yeah, you guys heard a little bit about my background. 14 years in specifically healthcare. A little bit more context there is implemented the first part of my career within healthcare. Had the distinct honor of doing a lot of EMR implementations, Epic implementations, that type of thing, and then pivoted back over to kind of my background and my strength, which was in information security. So definitely an interesting past 12 to 14 years, but yeah, we'll kind of head right into it. So very applicable discussion right now. I think, if you guys watched the news last night across CNN, Fox News, and all the very large and local headlines as well, ransomware has kind of made a comeback, not in a good way, right? So, but where I wanted to start, I kind of thought a lot about this when I put the deck together, and just kind of a re-education about, what is this? Where are organizations at? Where do they need to be from a strategy perspective? And how can they partner? So ransomware, I won't go into too much detail here, but, ransomware is a malicious software designed to block access to a computer system until a lump of sum, money is paid. And a lot of what we're seeing, at our organization, what I saw, when I was in the healthcare sector, was blocking access to clinical EMRs. And sometimes it was the actual EMR, and sometimes it was underlying infrastructure or just the devices that the users were utilizing to access those clinical systems. And we know that, not only does this, create a chaotic environment within a healthcare environment, but also it affects revenue. We're seeing ransomware attacks, less about, 8 to 24 hours affecting an organization, but more affecting organizations for a week, 2 or 3, or even a month of downtime for accessing EMRs or other core systems during a global pandemic. So we're seeing the likes of organized groups like our YUK, RIC or RIC, however you might pronounce it in your area, using things like TrickBot ransomware, very new, sophisticated, and well-funded organizations targeting health systems and really wreaking havoc in the last, we've seen it for the last 6 weeks really ramp up within healthcare, specifically in large integrated health systems. But now in the last, I would say 48 hours, I mean, really that new to last 2 weeks, we're seeing smaller regional health systems, challenged with regard to ransomware. So we wanted to kind of jump in and talk about, how does ransomware typically work? And, it isn't, it hasn't changed all that much. They're still using, email as the number one, vector to get into an organization. And given the large volume, you look at, a mid-sized health system, they're consuming 1 million emails per day. So a lot of that, within most organizations, 90% of it, they're blocking at the edge. But it only takes, 1 or 2 to get into an organization, and in fact, so the users click and the attack begins. The worm kind of gets on the network within file systems and PCs, and really just gets a stronghold within the organization, and then the command and control begins, and encryption begins, and these new ransomware attacks are really organized. These are not drive-by attacks. These are, the Raya Korea group is really well funded. They are doing the great marketing, utilizing the great marketing that health systems are doing, and they're doing investigations, within your organization, and targeting your executives, and really focused. I mean, this is not a drive-by. And then they begin lateral movement, right? So that they want the encryption to spread across the environment so that they gain a great foothold. And then, like I said, the encryption starts and really begins to impact clinical environments, and then organizations are going into incident response mode. So the next question that we have is how does it get into a health system, and what are some of the key statistics? And we talked a little bit about that, but to kind of reinforce, email threat and phishing are the number one, and it's really social engineering. Our staff are working, we all know this, they are working harder than ever in 2020 and in the response to COVID-19. So some of these attacks, quite honestly, are taking advantage of that. They're asking staff to make sure that they've completed their annual training. They're providing extra information with regard to COVID-19. So they're using the pandemic against ourselves, and because we're trying to educate our employees, right, with regard to COVID-19. So again, it preys on social engineering. A lot of our staff aren't looking for the irregularities in the emails because they're just trying to get work done. And so when we talk about that 90% that came from the Verizon annual report in 2019, one thing I'd like to share, though, in addition to that, is in the last 90 days, there's been some surveys and some data collected, and ransomware, in addition to what was happening before, it has increased 75% on top of what was happening in 2019, the beginning of 2020. So it's a much greater risk. Some other context I'd like to provide is, sometimes it, is a pop-up. So, it asks for action. It's an attached invoice that then has a payload in it, and it affects your PC. And then, like we said, it spreads laterally within the organization. They can lead you, some of the links within the email lead you to malicious sites and downloads. And then, like we talked about, an attachment. So network threats is another threat vector that we believe is another 30%, and that's what the Ponyman Institute 2017. We think that has kind of stayed. We think email is still the number one threat, but that's careless browsing, drive-by downloads, spoofed emails. We see the spear phishing and that type of thing, but as well as they're spoofing and doing spear type phishing. Similar to what you see in email on websites. So it'll point you to an email that's been very customized, right? It can look exactly like your MyChart page, exactly like your Epic patient page. It can look exactly like your ServiceNow page. And all they're trying to do there is gather those credentials. They're coming back behind, looking for an area that doesn't have multi-factor authentication, that two-factor authentication that requires you to type in your email, your username, and then maybe accept access on an app, or enter in a token. So some other things that we're seeing a little less is free VPN and Wi-Fi and that type of thing, but still a common threat vector. And then the last area that that we don't think much about, that is probably a minor entry point, but very vulnerable. So the threat actors are typically operating overseas or using cloud instances within the United States. But the other threat vector that let's say we solved all, remote access and that type of thing. We know that within health systems that, USB drive access is very prevalent, external hard drives and other peripherals. So that is another, we're not seeing a lot of that, but what we want to highlight is, it's really a defense in depth strategy that needs to be in place. So let's kind of transition and look at some statistics, the business impact for breaches that have occurred in healthcare in the last couple of years, 2020. So 41% of organizations have suffered an operational outage that have affected productivity. And in this time, those operational, productivity and impacts to the patient are dramatic. So, let's think about a patient that's waiting for their COVID test, and an organization is ransomware, and they don't have access to their lab systems to look at patient results, right? That connection to their third party, whether it's a state or whether it's a reference lab that you're waiting for results, those connections are not working. And then on the other side of it, it can be some other things that we're seeing is long lines in large metropolitans that have been affected by ransomware that have a single provider that's been infected. Long lines at pharmacies, right? So think about the automation that occurs between e-prescribing systems and EMRs, and it just automatically works. The provider prescribes the medicine, it automatically flows over to your retail pharmacy. When ransomware affects and disrupts an organization, those don't flow. So then patients are having to bring over or go back to their provider and get written paper prescriptions and bring them to their provider. And we know how inefficient that is and how it can affect a brand as well. And in some scenarios be really dangerous with regard to patient care. So 39% have had an operational outage that put patient clinical safety at risk. The other thing I would add there is we just had our first documented patient that unfortunately died in Germany, and it's related to ransomware. Their clinical patient care was so effective they unfortunately lost their life, and that's being investigated. Obviously, that's a homicide investigation and needs to be taken very seriously. So 32% talk about brand, and how that's affect them during a really challenging financial year within healthcare. We all know this, with regard to COVID-19 and how we've had to slow some of our elective surgeries and other surgeries within our facilities. 31%, in addition to the revenue impact that they've already had this year, are having this. And then 25% of lost critical business data, some of that being, not having backups and losing their entire medical record. That's been happening to some smaller providers, right? So that business continuity plans are very, very critical. But also it's happening to research institutions that are tied on to large health systems. So, think about that IP, that important data that so much work has went into by research teams and scientists to really improve the human condition. And losing that data is not only devastating, but it's also very expensive. So repercussions are dramatic. 72% of healthcare data breaches leak medical data. And then the average cost that we're seeing in statistics today is about $6.5 million. So we'll kind of move on here and talk about, healthcare providers must protect the growing attack surface. So 80% of healthcare organizations are using a medical Internet of Things. So, that's kind of exploded as well this year. We look at virtual visits and some organizations moving to virtual health kits, creating that contactless patient experience. That really grows the attack surface and makes the risk so much greater. So it's really important that organizations are doing strong security risk assessments and making sure that what the digital transformation they're moving towards is secure. Some others that I would kind of move past here, almost 80% are making cloud adoption strategy, as a strategic priority. As well there, we need to be doing risk assessments and make sure that we're partnering with companies that, really have security foundationally in mind. And then 60% of data breaches are carried out by internal threats. And in my background, I've got a lot of experience kind of outside of ransomware. I don't know that our internal threat with regard to ransomware is all that high, but we are seeing, significant security and privacy incidents with regard to our own staff, unfortunately, either selling data or misusing data for their own personal interests, which is disappointing and reinforces some of the, access requests or access audits that we need to be doing as well. So attacks are ongoing. Attacks against healthcare increased 60% year over year. I think this year we've seen that grow even more. I've talked about the 75% with regard to ransomware. 41% are caused by email, and then 18% target health systems, making it the second most targeted industry today. So healthcare compliance requirements, about 51% of organizations are saying that they're failing to meet some of the basic HIPAA, compliance requirements, and we know that number hopefully will be improving. 83% of physicians recognize that HIPAA compliance isn't enough, right? And that's very true. And HIPAA is very, I would say, foundational. I think organizations that really want to protect themselves need to be leaning upon things like NIST and high trust and, in their payment card processing environments, PCI, as well, as long as SOX and other things as well, because HIPAA isn't going to be just enough. It is very focused on privacy. It does have, obviously, a security language in it, but it just isn't enough. So achieving security compliance really requires understanding of healthcare cybersecurity challenges. Our industry is so much different than others. We do have some areas within our organization that are similar to retail or OT, those types of things, but the healthcare provider part of it and the workflows are really a lot different. So, I talked about this earlier. We've seen a 75% increase in ransomware attacks on healthcare. Just some examples of that. A large academic health system suffered 1 week of EMR downtime in September. So that's very fresh. It was very challenging in that environment and how it was impacting them during a really increased time of COVID and them being kind of a hot zone. And then a large national and global health system suffered greater than 2 weeks of EMR and system downtime in October. So what we've seen since then, I built this out a couple weeks ago, but in the last 2 weeks now we're seeing, I think, I look at the headlines every week and I know of at least 10 health systems that are either just coming out of the last week of being infected. And these infections, just to kind of give you my perspective and what I'm seeing across customers and across the landscape as I talk to my peers is these are happening over weekends. And I don't want to scare everyone going into Halloween holiday weekend, but what's happening is the bad actors are starting to, really on a Friday, social engineering people when their guard might be a little bit more down going into a holiday weekend. I've seen this over Christmas, and I've seen this over in my security operations center in the past, Christmas, Thanksgiving. They're really taking advantage of that time of the year, taking advantage of a pandemic when people's guard are down, and it's really unfortunate. And then the infection is occurring over the weekends, and really organizations are having to ramp up over the weekend and deal with the response during a really difficult time during a week when our physicians are doing more rounding, there's more surgeries occurring, and that type of thing. So what are some of the key strategies to protect from ransomware? So we've kind of talked about, here's what's happening to organizations, what's the strategy. And this slide is just to really, educate how difficult it is. So these are all the different kind of components, verticals within the healthcare, industry, where our data is going. If you look at, we're giving data to payers have a lot of data, medical suppliers, obviously hospitals and long-term care. We're doing a lot more telehealth, which has, really expanded the threat landscape. When we look at telehealth, I know my two last organizations, we were doing very little telehealth. We were doing 60 to 100 virtual visits per month within our organization. And those two same organizations are now doing 45,000 video visits a month. And that's kind of leveled off now at that number. So you think about digital transformation and how organizations have just turned on a flip to provide different types of or different types of patient access really quickly, which has been great, and I think really benefited our providers, kept them more safe, and also our patients. But what that does is it really expands the attack surface. So now that an organization has pivoted to doing, let's say 50,000, 45,000 video visits a month, what if an organization was struck by a denial of service attack or ransomware attack, and they weren't able to do those 45,000 video visits that have been scheduled over the past let's say the next 2 to 3 weeks? That's super scary to revenue. That's super scary to our patients. But just kind of illustrates how the attack surface is kind of expanding. So kind of wanted to go through some healthcare cybersecurity strategies and where organizations really need to focus their time from my perspective and our organization's perspective. So when I look at an organization from a security perspective, I look less a lot of times at the technology. The technology really drives the innovation to keep them secure. But first and foremost, with regard to ransomware, information technology is key. Making sure that you're doing lifecycle management, making sure that you're doing patching. Those are all really important things, because if you look at, let's say, these trick bots, these new flavors of ransomware, they're all having to really take advantage of some type of vulnerability. So let's take Windows, for example. The Windows operating system likely has a vulnerability in it, or another system. It could be Unix, it could be another, could be an iPhone, that type of thing. They have to have a vulnerability for the ransomware to take advantage, or the malware to take advantage of. And if that patching has been completed, if there's IT governance in place, and we're patching devices very timely, then the risk for that to occur within your environment is much, much less. So it takes a layered approach. I think creating visibility, having an enterprise risk management program so that the organization always knows where they're at within the life cycle of cybersecurity. And a lot of organizations have an enterprise risk management process for clinical risk, for facility risk, those types of things. But wrapping information security into that enterprise risk management program so that it's looked at in the same plane of glass at the board, at the finance committee, and at the C-suite is super important. So information security policy, compliance, and internal audit oversight, I think, is important as well. That internal audit, partnering with information security and information technology to really drive visibility to the organization so that it's not a burden of IT to tell, hey, if we're secure or not. Having a strong internal audit function over cybersecurity is very important. Executive leadership and board support. So if you're doing all these things above, providing them, the visibility within NIST, SANS, and high trust frameworks, and building an information security roadmap so they can get behind you and ensure that we're doing the right things within a health system or pharma to protect the environment is really key. And I think that having a board comprised of individuals that really understand cyber is the next step healthcare needs to go. They need a CISO on their board. If it's not a CISO, it needs to be a CIO from another organization that really understands the risk and really understands some of the detail driving it down throughout the organization, because this is now an operational and brand issue for health systems. So I get asked a lot of times, what do I need to do, Troy? Where do I need to go? Where's the silver bullet to protecting an organization from ransomware? And there is no silver bullet, unfortunately. Some of the things I talked about really layer upon some of these key. So this is a CIS top 20 security controls. And this isn't just for ransomware. I highlighted ransomware, but this can play into, I would say, 95% of threats to a health system. So I'm going to highlight a few of these, but first and foremost, the first two is having an inventory of all your devices that connect, whether that's hardware or software items. You've got to know what you're protecting before you can protect it, right? continuous vulnerability management. I can tell you that, yesterday, I sit in a different seat than I used to, but when I was a CISO for a large health system, the first question I would ask when there was a 0-day ransomware attack is I would go into my security operations center, and I always knew that I needed to put together an executive summary before our board or executive leadership became aware of a threat. And the first thing I would ask is, with regard to the specific vulnerability that was going to be called out on CNN either at noon or Fox News at noon, or, where are we at from a vulnerability management perspective? That threat, that vulnerability that's being exploited, what percentage of our devices have been patched? And I'll kind of go back to something you might remember, but was the WannaCry threat. That was kind of the last big ransomware that affected, a lot of organizations globally. But when I went down to my SOC, we build out an executive summary for each event. And one of the key things that I wanted to highlight was, okay, how many of our devices are vulnerable? And within WannaCry, with my organization at that time, we had patched already within 30 days, 82% of our devices. And having that visibility very quickly so that you're not having to trace down that information is really critical. You don't want to be working to find out how or where you're at with a specific vulnerability, once you're already, kind of in the mix. Some other things that I would highlight is secure configurations, web and email browser security. So important to have a strong partner and technology that's well baked and well implemented within your environment. Like we said, 90% come through email. So you need to be doing a good job, have a good technology that's completely integrated into the security fabric of your organization. Malware defenses and EDR can do a great job of limiting the damage if it does get past your next generation firewall or your perimeter firewall as well. And then something that we haven't talked a lot about that really falls within IT governance is data center recovery, data recovery. So most organizations are going to have small outbreaks of ransomware. Hopefully the things that they're doing from a layer perspective minimize how large the breach occurs. But if it is small or if it is large, it's really important for you to be able to have access to that data. Practice your incident response plans, have tabletop exercises that includes everyone within your organization, even some board members. It's really important so that when you guys do have a breach, that you guys know what you're going to do. You've exercised it, because it isn't a matter of if, it's when. It might not be a ransomware attack. It could be a third party that you're having to respond to. And I think one of the last things I would just reemphasize is incident response is super important. So security technology and partnership, I haven't hit a lot on that, and that's for a reason, because I think having everything else in place and then looking at your technology and your partner strategy is really important. So always, and from my perspective, and there's a few reasons for this, ensure that you've got an enterprise security fabric and platform in place. You want to reduce, and organizations are really challenged by, from a financial perspective, but reducing from having, 20 to 25 partners and technologies within your environment that are really hard to manage, get that number down to 12 to 15. I know within an organization of 45 hospitals, we had 12 to 15 partners, and that was it. And that was by design. It was really to make things more simple. It helped with training of our staff and our engineers. We know that, acquiring qualified staff is really challenging. So having something that is something you can get them up to speed on is really important. Utilize a high 90% of the technologies and features that you're buying. Do not buy shelfware. If you've bought something that you're only using 20% of, it's probably more advantageous to get rid of that product. Do not maintain it and reinvest that money into areas that can really improve your environment. So many times we go into health systems and other organizations and industries as well, and we see, 20 products that are only 20% implemented. And what I can tell you is that 10 products really well implemented with really strong partners is just going to do so much better for you. So as you're selecting partners, make sure that they understand the healthcare threat landscape. Make sure that they know really deeply within an organization what your EMR looks like, what are the other clinical systems, what are your workflows. That's super important. Make sure that they've got a comprehensive security portfolio product so that you can eliminate and do some technology consolidation. And then make sure that they're positioned to be able to do instant response, and potentially we've seen some of this ransomware negotiation. So working with your cybersecurity insurance folks, working with your legal teams, you want someone when an event does happen, because I think even the best laid plans, unfortunately, there's still risk, and there, like I said, there is no silver bullet to protect you from this. You want to have that backup. So another thing that's been really important to me is invest in your security staff training and development. Invest in the staff that you recruit to your organization and retaining them. I can tell you, when I look at security programs, and it's a group of, let's say it's a group of 25 people, like a mid-sized health system. Those that have retention and have trained and invested into their staff, that have had them there for a number of years, are much more successful, in keeping those systems in really good health. So threat intelligence partnerships are really important. One example I would share with you is the morning of WannaCry. When that happened, I valued my partnerships, when I was in the CISO suite, very highly. And in that scenario, it was 4:00 in the morning. My cell phone rings, and it wakes me up, and it's from a contact that I have at a partner. And their threat intelligence team was seeing WannaCry overseas because they were a global company. And what was happening in that scenario is they called us. They valued our partnership. They knew we were in healthcare. They knew that WannaCry was focusing on healthcare. And we stood up our SOC. We had a 24-hour SOC, but we ramped up our team. We had the visibility before it really became or spread over the United States. And we're really proud of that outcome. We're really proud of that vendor. And it just really grew our relationship. So things like, that we have at Fortinet with FortiGuard labs that are, circling the globe, up all night, looking at these threats, ready to help our customers, are super important. And then the last thing that I would mention, just kind of here in closing, is things like, the CSOHIMSS Central Southern Ohio chapter is a great information sharing collaborative. Keep doing things like this. Join national. There's many national and regional and state cybersecurity. Get your chief compliance officer out them. Get your CEO out at them. Not just, this isn't a CISO or a CIO issue. This is an organizational issue. So get them involved, and I think that everyone will be better for it. So in closing, that's all I had for today. I know we're up against lunch and up against the weekend. I really hope that you guys enjoyed the session, and I think we'll open it up, Mark, for questions.
So I don't think mics are open technically, so let me see if anyone has posted. I have not seen any questions posted.
Troy, this is Rob Stillman. I do have a question. How does cloud impact all of this? There's, moving off-premise applications to cloud. Yeah,
good question. So with regard to ransomware, there are some benefits for cloud. There's also challenges, right? So cloud really extends, our borders, right? And there are some key benefits, and I don't want to. I've always been a big advocate of cloud, even coming from the security space. One, I think that it can make IT organizations more nimble. They can focus less time on working on that or managing that infrastructure and get more time done on innovation. However, you do need to invest in cloud security technology to protect those environments. And you want those environments to mirror what you're doing from a cybersecurity perspective to your on-premise epics and those types of things, so that you're not having to pivot over to another tool to protect them. when organizations, I think they fail is they don't have good IT governance, and they go throw in, maybe a cloud tool, and they don't include either information technology or information security, and they don't wrap that same security protections in place. All right, other questions?
Hey, Troy, this is Alex Valancourt. I got a question for you as well. So,
yeah.
And thank you very much for the discussion today. My question is around, as we learn from other industry sectors, and you mentioned a little bit about, an organization that reached out to you and said, if you guys are seeing this in healthcare, do we see more of that? Industry cross-population and questions of learning from each other, particularly in the security sector?
Yeah, I think we should. I think that as one example of that I would give is as healthcare becomes more retail and has more of a retail focus, retail in some scenarios, because of their scale, sees much different attacks and focus attacks around payment card systems and that type of thing. So healthcare as it is today doesn't necessarily face that similar type of retail cardholder data, types of ransomware attacks. However, what I would say is as we continue to grow into retail, we should be partnering with them and getting some lessons learned. I think, financial services has kind of led the way, kind of long-term with best practices, standardization, strong IT governance. So there is a lot that can be learned there. And I think it is getting better. We're starting to see, folks in my position move from financial services to healthcare, move from healthcare to financial services. And there's some benefit in that. There is a significant ramp up in moving, industries. But I think, having, like, for example, NHISAC, so Health ISAC, collaborating with the retail ISAC and the financial services ISAC is important as well.
Great, thank you.
Yeah. All right.
Mark, do you want to, it looks like there are a couple other questions posted in the Q&A.
I'll go ahead and read through these. So, what's the update with the mention that Eastern European hackers that are targeting U.S. healthcare systems this week, and the FBI identifying that to healthcare providers?
Yeah, so there's a lot of activity, right? I would say the last week or 48 hours, that's been a big focus of ours at our organization, within our FortiGuard labs. And, us really looking at that ecosystem and seeing where our healthcare clients and then some new healthcare clients coming to us being targeted. But yeah, so kind of speaking to that. So that's that REAC attack that's happening using TrickBot ransomware, which is a little bit newer ransomware. But the REAC group is really well organized. And it's less about the ransomware and less about the malware that they're using and more about how coordinated those are occurring. So they're learning a lot about your organization. They're doing significant weeks or months of due diligence, right? And they're really well funded. So like I think a lot of you have noticed, HISAC is a great group within healthcare that provides security intelligence, great summaries. Your partners as well, like us at Fortinet, have FortiGuard labs that provides intelligence to our customers. I think leaning on those folks and getting that intelligence is super important because this is real. This is absolutely real. It started, I would say, this has always been happening, but we've seen a significant ramp up in the last, I would say, 30 to 60 days. And then the last 2 weeks has been even more significant, but less bigger players, a large volume of smaller players, which is concerning.
Okay, I appreciate it. So I have so far 2 more questions.
Yeah.
So next one is from Jennifer. So obviously, thanks to you for the presentation. She shared that she was at a critical access hospital and was attacked about a year ago. So obviously it had some major impact with that organization. She did ask, though, that she heard rumors about insurance for cyber attacks / ransomware. are there really insurance options out there against that?
Yeah, there are. Great question. So cyber insurance does exist. It can protect you. They do have high, really high, thresholds that you need to overcome before it, in some organizations it's $1 million, that you really need to, be impacted by. So ransom, or I should say, cyber insurance is really important. Some of the other things that the cyber insurance should be providing just outside of that monetary reimbursement are things like staff training. They can host, or they should be hosting if they're a good one. They should be hosting and helping you with incident response tabletop exercises. In some scenarios, this is kind of a new trend that we're seeing, and I don't know how long this will last. I don't know how much this will continue to be an option for folks, but there are now organizations working with cyber insurance companies that are negotiating the ransomware. So that was pretty popular about 8-10 months ago. The government, I think rightfully so, is really nervous about that because we want folks setting up their environments to protect their environments. We don't necessarily want them just leaning upon cyber insurance and trying to renegotiate a lower cost, right? So this is really something that's getting a lot of talk. It is interesting. They have been able to, if you think about it, it is very concerning that they're actually having conversations with the bad actors, negotiating down the ransomware, and in some scenarios helping organizations.
Yeah, I was actually curious myself on that, based on, I know there's the view that if you're essentially paying, potentially paying terrorists, even, that the government could certainly look at that a certain way. So
absolutely, yeah. There's concerns that these are terrorist organizations that could have other motives, right? And then I see the last question from Costello out there. How has the OCR responded to cases of ransomware, and do they blame hospitals? So great question. We just noticed or just recognized the first public fine from the OCR with regard to ransomware. And those of you familiar with the OCR, if you do have a breach, you do your breach notification. They do, basically like a what I would call a initial call. They ask you about what happened. They gather information, but then because the OCR is so busy, it can be up to 2 years later that you hear from the OCR. So we've gotten a lot of questions. Oh, wow, this breach happened maybe 3 years ago. The fine just occurred today. And what happens in those scenarios is the OCR does an investigation. They're looking to see if you're complying with HIPAA. They're making sure that you're doing an annual HIPAA risk assessment. They're making sure that you have policies and procedures that abide by HIPAA. And then they're looking for negligence, right? So for organizations that are doing, best practices, I don't believe, in my experience, that they're necessarily blaming, because this is a criminal activity, right? But they are looking to ensure that organizations are adhering to HIPAA. And it is possible for organizations to adhere to HIPAA and still be a victim. In those scenarios, I think that, and I know that the OCR is not passing blame or fines, but they are ensuring organizations are improving their security practices.
Very good. So I don't see any more questions.
Actually, Troy, if you don't mind, I do have one of my own as well. So following a little bit with the theme of our conference, and as we look at we're all transforming healthcare very, very rapidly over the last 8 months. And with your view on what's going on in the cybersecurity space, do you think we're going to look back at 2020 as a year where it was, this huge spike and all these issues and all that? And do you think it's going to settle back down in years to come? Or do you think this is just kind of the start of, kind of the cybersecurity wars for years to come?
I think great question, Alex. So when I look at customers and I look at healthcare organizations, and, in my background, I acquired, I think, 25 health systems. So I got a lot of, exposure to, what do a lot of different health systems look like? from a risk perspective. I think unfortunately, because the risk landscape, our move to, digital innovation is growing, and we're still leaving behind some of the fundamental IT governance, patching, and those types of things. I think unfortunately this is still just the tip of the iceberg, right? And what needs to happen is organizations really need to embrace this, and sometimes that takes some monumental events, and so I do think we're just at the tip of the iceberg, but I think that healthcare is getting better. Unfortunately, in some scenarios, the bad actors are moving just as fast or quicker. All right.
Yeah, maybe Alex, I'll just kind of keep it with you. I know Rob was going to tee it up, but I think at this point, since you were on.
Well, I also see one last question there in the Q&A. Are you aware of any specific breaches related to telehealth?
Yeah, good question. So I'm not actually aware of anything that's compromised the data of like a telehealth visit, either the data or the video. However, I am aware of many that have compromised the ability for organizations to do telehealth. So when ransomware has taken over many organizations, also brought down their patient platforms, so their portals that are supporting their virtual visit platforms. Many organizations have had to shut those platforms down for days or weeks, which is not a good thing from a customer perspective, not a good thing for our patients. So not so much the data or the videos, which we've got our eye on, right? How terrible would it be for whether it was just a screening, a COVID screening, that type of thing, but think about we're seeing much more mental health being used as a platform for virtual visits and that type of thing. And that's concerning. That information is very private and sensitive. And it's important that as we're deploying these virtual visit platforms, that we're doing in-depth risk assessments of those platforms, but then also, doing pen tests of them, making sure that we have security in front of them as well. Some of them are very good. They've been around for a long time, but we are seeing a trend of new operators coming to that market.
Very good.
Yeah. Well, yeah,
All right.
If there's no more questions, I've really appreciated the opportunity to speak here. My contact information is at the bottom. We're always here to help and answer questions, and really appreciate everybody's time.
Thank you very much, Troy. Truly appreciate it. Great perspective to share with the group here.
All right. Thank you, everybody.
Yep. Thank you. All right. So I get to try to wrap us up and bring us home in terms of closing out today's session. I want to say thank you very much for all of our attendees for joining. Hopefully we brought content to you guys, and our speakers did a phenomenal job today, but always want to make sure that it's relevant to what you're dealing with in your organization. So thank you again for all of our attendees and CSOHIMSS members for joining this morning. Just again, a brief reminder that next Friday is day 2 of this. And I'll tell you, always interested in your input and feedback. We've struggled as a board and worked through, in the past when we've done a physical conference, it's been a full Friday and do it all in one day. And we felt that I think everybody would be zoomed out to try to do a full 8-hour day. So that is why we split this into 2 half-day sessions, and always interested in your input and feedback. Just so that you guys also know, and I think it was mentioned first thing this morning, part of this program that we put together also then provides CEU credits. So if those of you who are CPHIMSS and other certifications, AHIMA, I think it follows some of those as well, encourage you guys to take advantage of the CEU credits. So the content is always looking at, we always look at that from that lens and trying to make sure, we're bringing content that can help everybody who, like myself, who is a certified or registered professional looking for CEU credits. Lastly, also want to truly thank our sponsors for today and for next week. I'll kind of give a plug again for that group. Fortinet, thank you so much for your sponsorship. UpDocs, Cisco, Cover My Meds, VirtuaStream, Nordic, and Trinosys. Truly, I can't thank you guys enough for the partnership and your sponsorship for programs like this and bringing some of this content and bringing that forward. I know compared to a physical conference, the cost is not that much. However, there's still cost associated with pulling together virtual events like this. And so truly thank all of our sponsors for today and for next week. Last but not least, unless there's somebody from the board who has something else that they want to add, thank you again for today. Don't forget next week, and we'll be sending that out. If there's any suggestions between now and next week, we already have a pretty full agenda, but always open to your input and feedback for what you like and what you don't like in terms of content. And just to share with this group too, we are already in the process of thinking about how do we do a spring conference. As you guys know, that would typically have been in the Columbus area. We kind of go back and forth between the Cincinnati, Dayton, and Columbus areas. So the spring one would normally, if we were doing this in person, at this point, I don't think we all believe that we're going to be in the physical conference mode in the spring. So likely to be a virtual conference there in the spring as well. So always interested in input on what that looks like.